Hello, my name is Dana, and I just had the fat graft transfer and the plasma treatment. I'm 1 day out. Last night I slept very well with just one pain pill, and have a little bit of soreness in my cheeks and my jawline, and really that's about it. My face feels full, but it's not super painful.
As you heard from Dana, who sounds like Jodie Foster, I don't know if you noticed that, but we just did her about a day ago from full face fat transfer as well as plasma resurfacing. And Dana, if you could turn over to your right side here, you can see that the skin is just a little pink and the old skin is still intact. Her son over here is waving to her, and let's go and turn the other way. Let's look to your other side. So we're just showing you that at 1 day the old skin is still intact, and it doesn't look terrible, but it is quite swollen, and it will actually swell up a little bit more in a day or so, then come back down pretty quickly. And we're going to follow the progress of her skin, and that's a primary emphasis of this video.
I am 3 days out, and I'm experiencing a little bit of itching and a little tightness feeling. I'm kind of wondering what I've done, but I know the outcome is going to be great.
As you heard from Dana, she is now 3 days out, wondering what the heck she did and what she got into. But it is quite swollen. What you're seeing here, I don't know if the camera's picking up all the subtleties, but there's a redness to the face. It's a pink-red quality. Obviously not socially presentable just yet. The upper brow, forehead area is actually from a close-up view already peeled off, and the new skin is already forming. And the cheeks, go and turn to this way over here to your left. There's a darker color there. That's all the old sun-damaged skin that's still intact. But the great thing with this Rhytec plasma treatment is that the new skin is already forming below it. And go and turn the other side here. So simultaneous to the old skin staying intact, it doesn't matter if it stays for another 1 or 2 days, the new skin is forming below. The reason her skin is so glistening is that she's keeping it moist with Vaseline. Sometimes that can be a little bit of itchiness that she's experiencing, and that should subside in the next few days. But everything's healing well. Go back, turn back toward us. You can see the face is quite swollen, and oftentimes the swelling is the worst either yesterday or today. Is it worse today or yesterday?
I would say yesterday.
Okay, so yesterday was more swelling. Usually 2 to 3 days out, there's a lot of distortion, and it starts to come down. The next time we see Dana should be a little less swelling, and some of the swelling will migrate a little bit further down into the chin area. But this is not bad. You don't have much discomfort at all, do you? You shouldn't have any. Yeah, just a tight feeling, as Dana said. There's no discomfort at all at this point. Okay, very good, and we'll follow her along.
I'm 8 days out, and the itchiness has gone away. I slept better last night. The tightness feeling is dissipating, and I'm feeling much better.
As you're from Dana, we're now 8 days out, just a little over a week, and the swelling is down significantly, although she is still quite swollen. But there's a nice, beautiful shape to the face right now that's becoming more apparent than before. She is really about 95% healed. Turn this way over this way here, Dana. You see that from a couple days ago, all that brown skin has basically fallen off. There's a couple small flecks on the very far outside portion of the face, and that's normal to have, and that will fall off. And she can actually wear makeup now. Let's turn the other way. And you can see this is pretty much healed. There's maybe one little area that's about 85, 90% healed, but you can turn back and look at the camera now. The basic thing now is at 8 days, she's really pretty much healed to the point where she can wear makeup. She's going to go and take probably 1 or 2 more days off from work and start the makeup process in a day or so, but she can stop the Vaseline, switch over to Cetaphil cleansers right now, but she's doing excellent. And I am going on a trip the next few days, so we're probably not going to see her for a few more days, but she just looks awesome.
I'm 13 days out, and I have no more pain and no more real swelling, although we did go out to the movies on Saturday night, and I had quite a bit of popcorn, and I woke up a little bit swollen yesterday, but and today a little bit, but it's going down. I'm able to cover well with makeup, and I'm going back to work this week.
As you heard from Dana, we are now almost 2 weeks out, and most of the swelling is gone. Obviously, she's still swollen. I mean, this, without a doubt, that takes even up to 2 to 3 months for it to dissipate, but she's looking pretty presentable, even without makeup now, but she really needs to put some makeup on. There's a little bit of pinkness left to the skin. That may take up to 2 to 3 weeks to go away, but she can pretty much cover most of that with makeup. All the new skin is formed at this point, and I want you to turn over this way to your left. You can see all the new skin is formed. It's healed tremendously well. A little swelling along the jawline, which is to be expected. Turn back over this way. and you can also see a little swelling in the jawline. There's some redness, a slight redness into the mid-cheek area, but she's doing really, really well. And all this is really pretty much covered by the makeup. She's going back to work today, and she's doing wonderful. And most people take about 7 to 10 days off from work, and we're just in that ballpark today. So that is, I believe, going to conclude our video journey, although we could continue to take some more photographs in the future.